Start to weight bear, some things to keep in mind is you want to try to get as center as you can. So you want to try to get the weight bearing prosthesis directly underneath that event. Alignment is very important. Things to consider when you first start doing is you may want to take your scales that you're going to be doing at home to either the appointment with your prosthetist or therapist, so that way they can adjust the height because they want to accommodate for the height of the scale to make sure that you're not shifting and that you're going to keep that neutral alignment of your pelvis. So when you first start to weight shift, using an assisted device that will help hold you up in a good postural awareness. Utilize this time as you're going to be weight bearing every day to really work on that posture. Hip flexion is really hard to manage in OI because you can't add a lot of accommodations or any adjustments to that axle. So use this time now to work on that hip flexion. So ways you can do that is as you're shifting your weight over, think about squeezing your butt, lift up through that chest, and then kind of a little less dependent on whatever you're using. So if you have to use a walker or you have to use a table, just really try to avoid leaning down over it. You want to try to stay as tall as you can. That's also going to help with a good loaded weight shift versus just leaning down and getting the right number on the scale. So you want to, again, take this time, work on that alignment, and as you're holding it, hold that posture. And even kind of cue, think about you're going to push down through your toes. Feel how that pulls you forward over top of that leg. So getting that pelvis rocking forward is going to help load that leg in more of a neutral position versus hanging out on the heels, which again will kind of lead to that hip flexor tightness if they're staying on their heels too much. And if they need to break it up, split it up as much as you can. If beginning they can only tolerate 5 minutes, 10 minutes, split it up through the day, but again, working on maintaining this neutral posture. Okay? You start stretching, utilize the weight bearing prosthesis as a long lever arm. Use it to your advantage to help get that stretch. I highly encourage trying to get into a split stance stretch. Prone is excellent, but that's not how we move. We move in a dynamic manner. So trying to stretch in that dynamic way. So what we're doing is a lizard stretch or split stretch, however you kind of want to describe it. But the amputated side with the weight bearing prosthesis is on the table or the bed. You're going to put that sound leg down on the floor. You can start here in a flat position, but as they get more range of motion, you can come up onto your elbows.
Yeah, good work, sir.
Good job. And then you're getting more of that opening up of that hip. And again, you can progress it to doing more, stabilization. But again, you're stretching in a dynamic position. This is how they need to walk in that split stance. So we need to try to stretch in this position as well. Another option that you can do is also trying to work on that split stance is you're going to have the patient lay on their back with using that long lever arm with that weight bearing prosthesis on, just let it hang off the table. Again, you're trying to get that opening up of the pelvis, and this is more for the patient who just can't really do well laying on their belly, but it's a nice alternative to open up and to get that hip extension and that, that stretch with the hip flexors. Again, you can progress by, stabilization with the knee bend. You can start to pull it up, march it up. If you need to go straight to help with back pain, you can. So there is modification that can be done in this position as well. But again, it's a nice alternative to stretch those hips. To utilize with that weight bearing prosthesis on is for some trunk rotation. So now we just don't get a lot, especially when you're seated or using a wheelchair in between surgeries. So getting that mobility, getting that rotation is going to be very vital when we get to walking. So what you can do is using the weight of the training prosthesis with that leg, you're going to drape it over in front. And then with your arms, you're just going to open up basically like a rainbow or making a book. So go ahead and open up for me. So you get that nice trunk rotation, but you're using the counterweight of the weight-bearing prosthesis to kind of help hold that leg into place. But you're getting that opening up through the front of the abdominal wall, the chest, but you're getting that nice trunk rotation is what we need, because we need that when we try to engage those hip flexors within walking to get that leg to propel forward. And then slowly back over. Good. One more time. Good. And use that breath work, so try to breathe when you do it. Back. Perfect.